Lovely. So thank you very much, Mary, for inviting me to be part of this really very rich virtual discussion forum. And it's lovely to see everybody as well. And thank you to everyone for giving up your time to be here. So what I want to do is I want to talk about a piece of very technical legal analysis, but I want to try to do it in a way that is nonetheless at least a bit interesting for the non-lawyers in the audience, because of course this is a multidisciplinary set of virtual workshops, virtual discussions. So I'm going to spend some time talking about as well as a little bit of detailed legal analysis. So if you could go to the next slide, please, Mary.
Yep.
So as I think is very well known now, part of the referendum vote in the UK to leave the European Union was based on the false idea that leaving the EU would mean more money for the NHS and better health. And in fact, of course, that's absolutely not true. It's very, very clear from all our analysis and analysis of others that actually leaving the EU is really bad for health and bad for the NHS. But nonetheless, this idea was out there. So it is actually important to study what the effects of Brexit will be and have been and are being on and health. And that's what our project, if you could go to the next slide, please, is doing. That's what it's all about. So this is the project as a whole, if you like, kind of encapsulated in terms of one method slide. So the project has lots of different bits to it. And some of the bits have much more to do with ethnography than legal science. And I'm not going to be talking about those bits today. Today, I'm going to talk about the bits that have to do with legal science. And in particular, I want to talk about what are the effects of the withdrawal agreement, that legal text, on health, and in particular, health of people in cross-border situations. So can you go to the next slide, please, Mary? So, as I just said, the withdrawal agreement is a formal legal text. It formally binds the UK and the EU in international law, not obviously bind the UK in EU law, but it is nonetheless a formal legal text. And part of this text, can you go to the next slide, please, Mary? Thank you. Part of this text gives rights to individual human beings in the same sort of way that the EU treaties give rights to individual human beings. Now, of course, those human beings need to fall within the scope of the withdrawal agreement in order to have rights. And this is just one of the relevant scope provisions. So you can see that this is actually quite complex. The text goes off the slide. It's not particularly straightforward to work out who is in the scope. Can you go to the next slide, please? Oh.
Is that
back to slide 6. So back 2, please. There we go. So people who fall in this part of the withdrawal agreement, which is Title 2 of the part on citizens' rights, have these sorts of rights. In particular, rights. They also have rights about employment. They have rights to have their qualifications recognised and things like that. You go on to the next slide, please. People who fall in Title 3 of the relevant part of the withdrawal agreement have slightly different scope rules, and this is again part of the text of the scope rules for Title 3. So we've already got emerging quite a complex legal situation where you have one set of scope rules under Title 2 for the bit about citizens' rights that's really very well known, well, reasonably well known, and then you have another set of scope rules under Title 3, which is for the part on coordination of social security systems. And EU health law nerds like me know that cross-border healthcare falls, among other places, within the coordination of social security systems in terms of its position in the architecture of European Union law. And next slide, please. the legal rule about social security is actually a relatively simple rule in the withdrawal agreement. It is just the rules and the objectives in the relevant treaty provisions and the relevant regulations of EU law. These are the social security coordination rules, shall apply to somebody who falls within the scope of this part of the withdrawal agreement. Can you pop on to the next slide, please, Mary?
Of course. Yeah.
So the rules themselves are quite complex, and you could start writing a kind of legal, doctrinal, legal science type account of how the rules work. But of course, what people actually want to know is, what do they mean for my rights to access cross-border healthcare? What do they mean for my rights as a pensioner or as an employed person? What do they mean for the rights of my family to access cross-border healthcare in that kind of situation? So next slide, please. What we have done to try to answer that question is to produce a very tailored analysis of, in this instance, the withdrawal agreement and its effects on this question of cross-border healthcare. And what we did to produce that tailored analysis, next slide please, was work closely with a number of health policy experts who were interested in these kinds of questions. So this is the group of health policy experts that we worked with across the whole project. Next slide, please. But for this particular analysis of cross-border healthcare in the withdrawal agreement, we were working with the NHS Confederation, and in particular with the NHS Confederation's link with something called the Brexit Health Alliance, which is an umbrella organisation looking at the effects of Brexit on health. What we did was in a social science sense, we had an interview. We interviewed the relevant person, Kate Ling, in the NHS Confederation. And in the interview, we asked her, what kinds of things is your organisation worried about in terms of Brexit and health? And that interview set up an ongoing relationship of co-production. And we used that relationship to talk to Kate about what the NHS Confederation and what the Brexit Health Alliance were concerned about in terms of trying to understand the legal position going forward. And we used those conversations, next slide please, to write a number of scenarios that capture the sorts of things that people and the organizations were concerned about. So this is one of the, I think it's 5 or 6 scenarios that we wrote together with the co-producer stakeholder. And we use this method across the whole project, but this particular thing that I'm talking about today is about rights in the withdrawal agreement. So this scenario is not based on a real human being, but it's realistic. There will be real human beings, there are real human beings who are in situations like this one. So it's not a hypothetical in a way, but it's also not an individual person. So you're in a good place in terms of the ethics of research here, because you're not encroaching on somebody's privacy when you're using this method. So in this scenario, George, who's a UK citizen, has worked in Luxembourg for a couple of years. He worked in the UK before then. But while he was working in Luxembourg, like a lot of people who work in Luxembourg, he actually lived in France. And then he gets a job offer to work in Germany, but this isn't going to start until after the end of the transition period. George doesn't want to move house, he wants to change his commute. But he's worried, is he going to be allowed to continue to reside in France? Is he going to be able to access EU social security benefits, first of all to healthcare while he's working, but also then his pension and healthcare while he retires, and so on. So this is the scenario. What we then do, next slide please, is we need to go into a lot of detail, legal detail, about his very specific rights. And this is the structure that we use in our scenario analysis. So first of all, we talk about George's residence rights, because if he can't reside somewhere, then he's not going to be able to have any of the other rights that flow from that, or in practice, any other rights realistically. So George is a frontier worker in the sense of EU law and in the sense of the Withdrawal Agreement. And he's exercised his right to reside in France. He's self-sufficient. He has comprehensive sickness insurance cover because he's covered by the Luxembourg health system, because Luxembourg is the competent state for the purposes of social security. Those of us who are into the techie side of EU social security law will understand what I'm talking about here. If you're not into that techie side, just think about the method and also think about the gaps, the changes from existing EU law rights. So he has exercised his right to reside in France, and he's done that before the end of transition, so he falls within the scope of the Withdrawal Agreement. He has a right to reside in France under the Withdrawal Agreement. He doesn't have a right of permanent residence under the Withdrawal Agreement yet, because he hasn't been resident in France for long enough. If he becomes unable to work while he's still employed in Luxembourg, so before he moves to Germany, he'll be covered by the Withdrawal Agreement. If he became temporarily unavailable to work as a result of illness, he'd retain his worker status. If he became permanently unable to work, that provision wouldn't apply, but he would be able to enjoy, under the Withdrawal Agreement, the right to equal treatment with a Luxembourg worker who became ill and permanently unable to work. He'd be able to access any unemployment or sickness or invalidity benefits available to Luxembourg workers. And so as this to prevent him from becoming a burden on the French social assistance system, he would be entitled to continue to reside in France under the residence provisions of the Withdrawal Agreement. So that's the first thing. He's relatively safe while he continues to work in Luxembourg. But the Withdrawal Agreement does not provide rights of onward movement. So George won't have any rights under the Withdrawal Agreement to take up employment in Germany. If he does take up that employment on the basis of German law, he would nevertheless remain within the scope of the Withdrawal Agreement because of the relationship between the provisions I showed you before, Article 10 and Article 30. And Article 10 covers EU nationals who'd exercise their right to reside in another member state before the end of the transition period. So long as George stays resident in France and doesn't move his residence to Germany or any other member state, he will remain within the scope of the Withdrawal Agreement. I told you it was technically complex, and it gets worse. So then we were moved on to think about, well, what are George's rights to enter Luxembourg and enter Germany to work? So from January 2021, George will retain his rights to enter Luxembourg to work because the Withdrawal Agreement covers frontier workers' entitlements. But the Withdrawal Agreement, as I've just said, does not give George any rights to enter Germany in order to work. Then we need to think about George's social security rights. And first of all, we need to think about those while he's working, and then we need to think about, well, what will happen once he retires? So in terms of while he's working in Luxembourg, first of all, we have to think, well, is George within the personal scope of Title 3 of the Withdrawal Agreement concerning the coordination of social security systems? Because that's where the rights to George's rights to healthcare, if they are anywhere, fall. Article I showed you a minute ago covered, and that includes UK nationals who are subject to the legislation of a member state at the end of the transition period. So while George is employed in Luxembourg and is contributing to the social security system there, he is subject to the legislation of Luxembourg. And so at the end of the transition period, that would be the case. And so long as he continues in that situation without interruption, he falls within the personal scope of Title 3. And that means that he has healthcare rights under the provisions in the relevant part of the Withdrawal Agreement. So he is residing in France, which is a member state other than the competent member state, which is Luxembourg. So he'll receive benefits, including sickness benefits, access to healthcare in France, as though he were insured under the French legislation provided for on behalf of Luxembourg, the competent institution, by the French national health system, the institution of the place of residence. And as a frontier worker, he'll also be able to access healthcare while in Luxembourg, and that's covered also in Regulation 883/2004, the Social Security Coordination Regulation. Now, what about in Germany? So we've already said George has no rights to take up employment in Germany under the Withdrawal Agreement after the end of transition. It would be only under German law that he would be taking up employment and residing in Germany. But George's entitlements under Article 30, so the coordination scope rules, are conditional on him falling within the scope provisions of the Withdrawal Agreement without interruption. Now, question for lawyers, does without interruption mean without change in status? I think not. So I think if a person switches from one of the categories within Article 30, they would still remain in scope because there's no interruption. But again, that's something that I might not be right about. We could disagree about how to interpret that legal text. So I think if George does take up employment in Germany under German national law, and he wishes to continue to reside in France, he'll still fall within the personal scope of the Withdrawal Agreement on Social Security coordination, because of the way that Article 30, the scope rules of that part of the Withdrawal Agreement, bring people who no longer fall within the scope of the agreement under Article 10 within the scope. Next slide, please. So this is part of our analysis. Since George still falls within the scope of Title 3, and remember I've said that that is contestable, even if he stops working in Luxembourg and takes up work in Germany, he'll still be entitled to social security rights, including cross-border healthcare, in the same way as if he continued working in Luxembourg. And that's because it's his residence in France, not his work in Luxembourg, that brings him within the scope of Title 3 of the Withdrawal Agreement. Now, this is one of the situations where the interaction between the scope rules in Title 3 and the scope rules in Title 2 that I showed you at the beginning becomes very difficult to understand, because the scope rules in Title 3 derive from a principle of EU law called the single state rule, that an individual's social security entitlements flow from a relationship with a single competent state. Next slide, please. But which is the single competent state in George's context? So George doesn't have an entitlement to be employed in Germany under the Withdrawal Agreement. Does that mean that Germany nonetheless is to be regarded as the competent member state for the purposes of George's social security rights, not his residence rights? And here there are three possible ways that we could interpret the Withdrawal Agreement. We could either say that the coordination rules cease to apply altogether, or we could say that the coordination rules apply in general, the general coordination rules apply, or we could say that there's an exceptional rule in Regulation 883/2004 that applies. So if the first interpretation is correct, George would only have entitlements to access healthcare in France or Germany on the basis of national law, not under the Withdrawal Agreement at all. And so there is a gap in the coverage of cross-border healthcare in the Withdrawal Agreement. If the second interpretation is correct, although George has no rights to work in Germany under the Withdrawal Agreement, Germany is nonetheless regarded as a state for the purposes of social security coordination, since George falls within the scope of that part of the Withdrawal Agreement as regards social security. If the second interpretation is correct, George residing in France, a member state other than the competent member state, which is Germany, will receive healthcare in France as if he were insured under the French legislation. And as a frontier worker, he would also be entitled to access healthcare while in Germany. If the third interpretation is correct, then we need to look to the exception in Article 11.3, which instead of the other rules, provides a rule of residence to determine the competent state. George is pursuing an activity as an employed person in a member state, which is the terms of Article 11.3. So taken literally, he does not fall within its scope. But it could be argued that George is not pursuing that activity as an employed person in the sense of EU law. He's only doing it under German law. So again, there is a lot here that is confusing for and open to different legal interpretation. Next slide, please. So we then continue to think about what happens when George retires. And in principle, the competent state for the purposes of pension provision is usually the state in which the person last worked. So next slide, please. But again, which is the competent state for a frontier worker? And here we have 4 different possibilities, and I'm not going to go through them in detail because they are similar to what I've just gone through, but there are arguments for all 4 of these different possibilities in terms of the competent state for George's access to his pension and for his access to healthcare, a pensioner. And so pretty quickly, when you combine the different scenarios and the detail of the legal analysis that you need to do, you get to a 34-page document of single-space type. And Mary, I think, has already shared access to that document if anybody wants to look at it. What we have also done, next slide, at the beginning of the document is provided a table that shows what is and is not covered. So this is a summary. So here you can see with respect to pensions, what's not covered. For instance, when you lose permanent residence, where there's a right of, where there's an onward movement. In terms of healthcare, potentially you lose it if there's an interruption to which state is competent. Next slide, please. And this is the rest of the healthcare. So again, there are some other gaps here in terms of, for instance, provision of family members who move after the end of the transition period, and so on. So, next slide. Just to try to wrap this up, and then we can open up for a bit of discussion. Here are my key messages. The law of the withdrawal agreement is complicated, but analysis of that withdrawal agreement is not particularly useful, and it's not useful unless related to real life scenarios. And so this method allows for producing granular technical legal analysis that is also very useful and tailored to the people that we were working with. And the method also allows different stakeholders to access on different levels. So we've got the table of the gaps, the summaries, and then we've also got the very specific reasoning which other lawyers can look at in detail and tell us whether we've got it right or wrong. Because of course we've got no litigation on this. We do have some statements from the European Commission, some official ones, some less official ones, about what the European Commission thinks the text means, but of course what the European Commission thinks a legal text means is not necessarily what that legal text means. Some of the benefits to this method, if there are any British law academics, I know apart from Mary, in the audience, you'll see that the scenario analysis method is really similar to the method that we use to examine our undergraduate and postgraduate, sometimes, students, where you write a scenario and then the students have to say what the law is with respect to that scenario. So that means that we can, and we do, involve undergraduate students in producing our scenario analysis. And you might remember on the very first slide that I named the 2 students that were involved in this particular analysis, Natalia and Jim. And because students in the UK context are trained to do this kind of legal analysis, with a bit of guidance and help, they can actually do quite a lot of the detailed thinking and produce drafts that I can then look at and talk with the students about and check whether they're okay. One of the main drawbacks is that these kinds of things might present as if you're offering legal advice. And at the top of our document, we have a big disclaimer that says this is not legal advice. You need to speak to an actual lawyer if you need legal advice. The link is there at the end of the slide. Mary, could you go one more slide, please? If anybody wants to look at any of the detail here, there are other scenario analyses on other aspects of health post-Brexit, and this is just a link to the references that I made in the earlier slide. So thank you very much.
Okay, thank you very much, Tammy. That was very interesting. I'm just going to stop recording before we go to A.